Hello and welcome to our channel. Today, we're discussing a sensitive and important topic: the signs and symptoms of a miscarriage. Miscarriage is a difficult experience, and it's crucial to understand what to look for and when to seek help. We'll be covering medical information, sharing personal stories, and offering support and advice. Let's get started. A miscarriage is the loss of a pregnancy before the 20th week. It's more common than many realize, occurring in about 10 to 20% of known pregnancies. Recognizing the signs and symptoms can help you seek timely medical care. 1. Vaginal bleeding. One of the most common signs of a miscarriage is vaginal bleeding. This can range from light spotting to heavy bleeding with clots. It's important to note that light spotting can also be normal in early pregnancy. If you experience bleeding, contact your healthcare provider for an evaluation. Bleeding can occur when the cervix starts to open or when the body expels pregnancy tissue. It's crucial to monitor the amount, color, and consistency of the bleeding. If you notice heavy bleeding, especially if it's accompanied by cramping or passing tissue, seek immediate medical attention. 2. Cramping and pain. Cramping and abdominal pain, similar to menstrual cramps, can also indicate a miscarriage. This pain can be sharp or dull and may come and go. It's often felt in the lower abdomen or back. Cramping can be a normal part of pregnancy, but severe pain or pain accompanied by bleeding should be evaluated by a healthcare provider. Cramping and pain during a miscarriage are due to the uterus contracting to expel pregnancy tissue. If you experience persistent or severe pain, it's essential to get checked to ensure your safety and well-being. 3. Passing tissue or clots. Passing tissue or large clots from the vagina is a clear sign of miscarriage. The tissue may appear grayish or include blood clots. This is the body's way of expelling pregnancy tissue. If you pass tissue, collect it in a clean container and bring it to your healthcare provider for examination. 4. Decrease in pregnancy symptoms. A sudden decrease in pregnancy symptoms, such as breast tenderness, nausea, and fatigue, can also be a sign of miscarriage. While it's normal for symptoms to fluctuate, a noticeable decrease should be discussed with your doctor. I remember waking up one day and feeling different. My nausea was gone, and my breasts weren't as tender. A few days later, I started spotting. It was a heartbreaking experience. 5. Lower back pain. Lower back pain, particularly if it's persistent and severe, can indicate a miscarriage. This pain is often described as dull and achy. Back pain can be caused by the uterus contracting or the body preparing to pass tissue. 6. Fluid discharge. Leaking fluid from the vagina can be a sign of miscarriage, especially if it's accompanied by bleeding or cramping. This can be a sign that the amniotic sac has ruptured. The fluid may be clear or tinged with blood. If you experience fluid leakage, contact your healthcare provider immediately. 7. Absence of fetal heartbeat. During routine prenatal visits, your doctor will check for the baby's heartbeat. If no heartbeat is detected after a certain point in pregnancy, it can indicate a miscarriage. If we don't detect a heartbeat, we typically perform an ultrasound to confirm the status of the pregnancy. It's a difficult moment, and we provide support and counseling for our patients. 8. Positive pregnancy test followed by negative. A positive pregnancy test followed by a negative test can be a sign of miscarriage. This may occur if hormone levels drop after the loss of the pregnancy. If you experience this, contact your healthcare provider for further evaluation and guidance. 9. Fainting or dizziness. Experiencing fainting or dizziness can be related to a miscarriage, particularly if it's due to heavy bleeding. These symptoms can indicate significant blood loss and require immediate medical attention. Dizziness or fainting can also be caused by hormonal changes. If you feel faint, lie down and seek medical help. 10. Intuition. Many women report a feeling that something is wrong before experiencing physical symptoms. Trusting your intuition and discussing any concerns with your healthcare provider is essential. I just had a feeling that something wasn't right. Even before the bleeding started, I felt like something was off. Listening to my body and contacting my doctor was the best decision. What to do if you suspect a miscarriage? If you experience any of these signs or symptoms, contact your healthcare provider immediately. They can perform tests, such as an ultrasound or blood tests, to determine if you're experiencing a miscarriage. Early medical intervention is crucial. Healthcare providers can provide support, treatment options, and counseling to help you through this challenging time. Emotional support. Experiencing a miscarriage can be emotionally devastating. It's important to seek support from loved ones, counselors, or support groups. You're not alone, and it's okay to grieve. Sharing your feelings with others who have experienced similar losses can provide comfort and understanding. Grief after a miscarriage is natural and personal. Everyone copes differently, and seeking support is a healthy way to process your emotions. Understanding the signs and symptoms of a miscarriage can help you seek timely medical care and support. Remember, these experiences are personal, and it's important to take care of both your physical and emotional well-being. Thank you for watching, and please reach out to healthcare professionals if you have any concerns. Don't forget to like, comment, and subscribe for more health information and support. Take care.